much. Elimination of hepatitis B. Those are my credentials. This is purely an educational intervention to support those who want to learn and benefit from hepatitis and the care of it. Right, so how can we achieve this? The learning outcomes. At the end of this presentation, it is expected that those who attend will understand why hepatitis is important, why you should care about hepatitis, and know the modes of transmission of hepatitis, recognize some of the symptoms of hepatitis B, the elimination strategies that can work. These strategies have worked for other illnesses. To know the treatment strategies there are for hepatitis B. Right, so how important is hepatitis? Hepatitis is simply defined as inflammation of the liver. Inflammation is just when an organ is not functioning well. That is just a blanket statement to describe when there is inflammation of the liver. It is called hepatitis. The liver is a vital organ responsible for three main functions, and those are processing of nutrients, filtering blood, as well as fighting infections. So when the liver is inflamed, these functions are compromised. When inflamed, the functions of the liver are affected, and so that is how the liver will go on to look like in very extreme cases. The picture there shows you how the liver has been replaced by scar tissue. So again, after an infection, an individual could either recover or have a chronic hepatitis, meaning that the inflammation has lasted longer than 6 months, and then or develop cirrhosis, which is when the liver is being replaced by scar tissue, and or liver cancer. I'll take one at a time. So majority of those who are infected when they're adults recover. A significant proportion will go on to having chronic hepatitis. Some will then have a scarring of the liver when the liver fails to function properly, and which is the most common route by which the liver then becomes end-stage damage and or develop cancer. Now, this is how the liver cancer looks like. It's a very large cancer there based on a CT scan, and which of course is potentially lethal, can lead to death very rapidly. Again, that's a summary. Four outcomes of infection: 1, recovery, chronic hepatitis, cirrhosis of the liver, and then liver cancer. Okay. How does hepatitis affect you? Now, 2 billion people are affected globally, and about 350 million persons are chronically infected, some of who will go on to develop long-term complications such as cirrhosis, liver cancer, and or end-stage liver disease. About 20 million Nigerians are living with chronic hepatitis B, and it will surprise you to know that only 2 million people may be aware of their status. The risk of chronic infection varies with the age at initial infection. About 90% of infected people, it occurs at infancy, that is within the first year of their birth. And then 20% of those infected when they are older children then go on to developing chronic infection. About 5% of those infected as adults will go on to chronic infection. In other words, when the immune system is weak, then the chance of long-term damage is high. And that is the concept where I'm trying to pass across here. Currently, there is effective treatment, but a cure is only possible in a minority of cases. Now, I'm very careful here mentioning the subject of cure for hepatitis B. This is because what people understand as cure may not be what is applicable in medicine. However, the cure, in which case there is eradication of hepatitis B surface antigen, is possible in just a small proportion, whereas many people can get their disease controlled and thereby limiting the chance of progression to cirrhosis and liver cancer. How do you get hepatitis B? There are about 6 I will take in this lecture. The first one is I'll take one at a time. A mother who is infected by hepatitis B will go on to give it to the baby, particularly one if she has very high viral load and she's not on treatment. Okay, and so very important and most common group by which Africans or Asians get this infection. Second one is when there is children who are infected pass it on to other children when they're playing together or within family settings, when there is sharing of objects, sharp objects in particular. Transfusion of infected blood and blood products. This was more prevalent during the past when they were not screening blood before giving it to people. So some people have inadvertently been transmitted by hepatitis B from transfusion of blood, infected blood. Use of infected or sterile equipment within the hospital setting is an important factor. Luckily, there's lots of regulation to ensure that whatever equipment in hospital being used should be sterilized. Sharing of sharps or razors or toothbrushes. This is very important because some people like to share brushes. This is very unsafe and has not worked very well for many people. And so some people have got infection without knowing how they got it, but this is an important way by which people have got, and people should pay attention to. The other bit is unprotected social activity with the infected person. If, for example, somebody has a high viral load and they sleep with another person who's uninfected, they will likely pass that infection. This should be very carefully interpreted because if there are people married to each other and they must consummate their marriage, that does not mean they must have protection. In other words, if the partner who's infected is getting treatment and it's well controlled, then they're safe to consummate the marriage. The other bit will be if the uninfected partner is vaccinated, they are protected, but almost 100% because the vaccine is very effective. Again, that's a summary. Mother to child, among family, transmission of infected blood, use of infected sterile equipment in hospital, sharing of sharp objects or razors, unprotected social activity with an infected person. What are the common symptoms of hepatitis B? Right, so let's recognize them. Most of the patients who have hepatitis B will never come with symptoms. So a lot of people will actually have to be investigated. Maybe they're going on to having some kind of hospital or pre-employment investigations. Then they picked up to have hepatitis, so they go to donate blood or something like that. A few people will have abdominal pain. Some will have dark urine, and some will be jaundiced, in which case they are very sick. Some will have fever, nausea, and vomiting, especially in the acute phase, that is within the first 6 months of infection. Some will complain of weakness and fatigue. Some will be very tired and experience some joint pains. Right, so let's go on to the subject. How can we eliminate hepatitis B? Because this is something that is key and will be something that is achievable. One, because there is an effective vaccine for hepatitis B. In fact, lots of publications identify that 98% or 100% efficacy, especially if the person who's received the vaccine fulfills a particular criteria. There is also an effective treatment, which will reduce the viral load, in which case it will reduce transmission, in which case, if those who are infected are treated very well, and everyone who is at risk receives the vaccine, then we will eliminate hepatitis B. And that is achievable. All we need is a government will and engagement of the public to ensure that this is achieved. So let's talk about the efficacy of the hepatitis B vaccine. It is about 100% protection, but if you receive the vaccine when you're above 40, or your weight or your height is very high, or you smoke cigarettes, or you are dependent on alcohol and or immunosuppressed, then your chance of developing immunity will be lower. But that does not mean it is lower than for those who don't have vaccine at all. So it's important that early in life, if you are unprotected and you are at risk, go on to have vaccination. Right, so who are those who are at risk of hepatitis B infection? One, an infant of a mother who's positive to hepatitis B, being born in an endemic area. Endemic means that when the disease is very high in prevalence, particularly in Africa. If you live in a family, if you have a member of your family has hepatitis B, then you are at high risk, okay, of developing hepatitis B or in getting infected. Or you're working in the hospital setting or in an occupation that exposes you to blood and blood products. Or you're a prisoner or living in correctional facilities, or you use drugs intravenously. This is not a very common problem in most African countries, or at least it is not commonly reported. And so this can be another factor. There are others, but I will limit this lecture to this few for now. Now, so this is a very busy slide. How do you prevent a mother, giving a child their infection? Now forget about how busy this slide is. I'm going to break it down to one after the other. I may use a few of jargons, medical jargons here, but please do not crack your brain to understand fully, but I will try to itemize one after the other to make it easier for you. So now there are three categories, okay? If you investigate a mother who presents to hospital and their viral load is very high, okay? Or not that if you don't have facility to do a viral load and you have facility to do hepatitis B E antigen and you do an ultrasound and there's no evidence of cirrhosis, meaning the liver is not stiff, then this is what action you should take. For the mother, don't give any treatment. Do not give any treatment when they don't fulfill that criteria. Defer long-term treatment, but monitor and assess the patient based on what the WHO says, okay? Now for this second category, when the viral load is more than 200,000 or they are hepatitis B E antigen positive and they don't have cirrhosis, then you start treatment. This is aimed at decreasing the baby from having infection, and the medication used is tenofovir. From 28 weeks of pregnancy, that is the last 13 weeks, and then after delivery, you reassess the long-term use for the mother. But this has been shown to reduce the mother getting the baby infected. The third category is when there is cirrhosis, whether or not the viral load is high or persistently abnormal liver function test, which is the blood chemistry test. Start long-term treatment, meaning that even after delivery, you continue treatment of the mother, okay? Regardless of any of these things, if the baby is delivered within the first year, you immunize them. Because even if they don't have it from the mother, they're going to live among other children who may be infected. And to decrease their chance of getting infection, please vaccinate them. We call it the hepatitis B viral birth dose vaccine, and they complete the rest of series. If you have facility for the immunoglobulin, then you give that to the baby as well. Right, so what are the treatment decisions? Now, the second of the elimination strategy for hepatitis B is to treat those who are infected. Now, not everyone is qualified for treatment, and this is reasonable because treatment is given with an intention to stop the cycle of production of the virus. And so if the virus is not actively dividing, there's no basis, there's no gain in treatment. And so this is how doctors make their choices about who to treat and who not to treat. Right, regardless of whether you're getting treatment or not, if you're confirmed to have hepatitis B, try and take rest. It doesn't mean you should sleep all your day, but just make sure that don't cheat yourself of the rest you need, because this can empower your immune system to be able to fight infections on their own merit. Second, proper nutrition. Make sure you get a balanced diet. Don't begin to eliminate food indiscriminately to the point that you lose your weight and are not really living healthily. Plenty fluids will be helpful to flush out any toxins from your system, and very rarely in the acute phase, hospital observation is required. Okay? Now, who are these people who qualify for treatment? Everyone who has the chronic infection, and remember, and not just everyone, and also has clinical evidence of cirrhosis, meaning the liver has become fibrotic, whether the viral load is high or low or even undetected, whether the liver function is abnormal or not, whether whatever. Once there is cirrhosis, there is a guideline that says treatment should be commenced, okay? Second category, if there is a hepatitis B and HIV co-infection, yes, make sure that one of the medications that the patient is receiving for HIV can work against hepatitis B. This is for a lifetime. For those who don't have cirrhosis, they must, of course, have evidence that the virus is actively dividing, and that is the viral load, which is about more than 20,000. Now, note that this is different from the 200,000 for pregnant mothers. This is what the WHO recommends. I will stop here. I believe that some of you might be available to have questions that you want to ask and know about the strategies to eliminate hepatitis B. But I will talk here. I believe that a lot of lectures have been going on today for elimination of hepatitis B as the World Hepatitis Day. This is just one of the interesting aspects I'm trying to bring across to those who would want to gain knowledge, and hopefully it shall stimulate a lot of discussions and we can learn from them. Thank you very much for coming today, and I will wish you well, and will get questions as appropriate. As many as have joined shortly after I finish,